surprising side effects of blueberries that no one talks about. Are you looking at that tiny blue fruit sitting in your fridge right now? Thinking of quenching your thirst by making a glass of juice out of them? Then hold on. Today, we're going to uncover the truth about blueberries, those small blue fruits that most health experts call a superfood. While they offer many health benefits, there's another side to the story that few people discuss. Blueberries are often called nature's candy. They're sweet, delicious, and packed with vitamins, antioxidants, and fiber. They help your heart, boost your brain, and even fight off diseases. But like anything in life, too much of a good thing can sometimes cause problems. In this video, I'll share who should limit their blueberry intake, the specific health conditions that make blueberries risky, and how to spot if you're among the small percentage of people who should approach these fruits with caution. Let's dive into the lesser-known side effects of blueberries. If you want to unlock the full potential of your health, make sure to like, subscribe, and hit the notification bell. Now let's get started. Number 1. Blood sugar concerns. Alright, let's dive into the world of blueberries and their sneaky little secret. While blueberries have less sugar than many fruits, they still affect blood sugar. Research from the University of Toronto found that 1 cup of blueberries contains about 15 grams of sugar. For people with diabetes or blood sugar problems, this matters. What's interesting is that the fiber in blueberries, about 4 grams per cup, helps slow down sugar absorption. But if you drink blueberry juice instead of eating whole berries, you lose this benefit. A 2020 study in the Journal of Nutrition showed that blueberry juice caused faster blood sugar spikes than whole berries. When comparing glycemic index values, whole blueberries have a relatively low score of around 53, while blueberry juice can spike up to 76 on the glycemic index scale. This difference is significant for those monitoring their blood glucose levels. The anthocyanins in blueberries have been shown to improve insulin sensitivity in some studies, but this benefit can be overshadowed by excessive consumption. For anyone taking medication for diabetes, such as metformin or insulin, it's particularly important to monitor blueberry intake. The combination of medication and the natural sugars in blueberries can sometimes lead to hypoglycemia if not properly balanced. If you have diabetes, don't cut out blueberries completely. Instead, eat smaller portions like 1/4 to 1/2 cup, and always eat them with a source of protein or healthy fat to slow sugar absorption. Consider tracking your glucose response to determine your personal tolerance level, as individual responses can vary significantly. Number 2. Digestive issues. Some people get stomach pain, gas, or diarrhea after eating blueberries. This happens for a few reasons. First, blueberries contain natural compounds called salicylates. These are the same compounds found in aspirin. About 2 to 4% of people are sensitive to these compounds, according to research from the International Journal of Immunopathology and Pharmacology. Second, blueberries are high in fiber. If you're not used to eating much fiber and suddenly eat a lot of blueberries, your gut might rebel with gas or bloating. A single cup of blueberries contains about 4 grams of fiber, which is nearly 16% of the daily recommended intake for some individuals. This sudden fiber boost can overwhelm the digestive system, especially in people who typically consume a low-fiber diet. Third, some people have trouble with FODMAPs, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, certain carbs that ferment in the gut. Blueberries contain these FODMAPs, which explains why some people with IBS, irritable bowel syndrome, feel worse after eating them. What many people don't realize is that the ripeness of blueberries also affects digestibility. Slightly underripe berries contain higher levels of tannins, which can cause constipation in sensitive individuals. Conversely, overripe berries may have higher sugar content and can ferment more readily in the gut, potentially causing bloating and gas. For those with diverticulitis, the small seeds in blueberries might be problematic during flare-ups, despite being quite small compared to other berry seeds. The seeds can potentially irritate inflamed pouches in the intestinal wall. If you notice digestive problems after eating blueberries, try smaller amounts or cooking them first, which breaks down some of the compounds that cause trouble. Blending blueberries into smoothies can also help pre-break the fiber, making it easier to digest for some people. Adding digestive enzymes or probiotics when consuming blueberries might help mitigate digestive discomfort for particularly sensitive individuals. Number 3. Medication interactions. Blueberries can alter how certain medications work in your body. Blueberries contain compounds that affect enzymes in your liver, the same enzymes that break down many medications. A 2018 study in the Journal of Pharmacy and Pharmacology found that compounds in blueberries can block these enzymes, causing medicine to stay in your system longer. This is especially important if you take blood thinners like warfarin, some antidepressants, certain diabetes medications, or any kind of blood pressure medicines. The flavonoids in blueberries, particularly quercetin and myricetin, have been shown to inhibit cytochrome P450 enzymes, which are responsible for metabolizing approximately 70 to 80% of all drugs. The CYP3A4 enzyme, which is particularly affected by blueberry compounds, metabolizes about 50% of all prescription medications. For patients on blood thinners like warfarin, the vitamin K content in blueberries, about 19.3 micrograms per 100 grams, can potentially reduce the medication's effectiveness if consumption patterns change dramatically. Wild blueberries may have even stronger effects on drug metabolism than cultivated varieties, due to their higher concentration of bioactive compounds. The timing of blueberry consumption relative to medication intake also matters. Taking medications within 1 to 2 hours of consuming large amounts of blueberries or blueberry extract can lead to the most significant interactions. Some research suggests that the effects of blueberry compounds on drug metabolism can last up to 72 hours after consumption. If you take any regular medication, talk to your doctor about whether you should watch your blueberry intake. You don't usually need to avoid them completely, but you might need to keep the amount consistent. Pharmacists recommend maintaining consistency in your blueberry consumption rather than dramatically changing intake patterns, as this helps maintain stable drug levels in your bloodstream. Number 4. Allergic reactions. You know how some people are super sensitive to certain things? Well, blueberries have this compound called salicylates, which is also found in aspirin and lots of other plants. It turns out some folks just don't get along with salicylates. Now, blueberries are packed with these salicylates, especially blueberry juice. So, if you're one of those unlucky people with a salicylate sensitivity, munching on blueberries might give you a hard time. We're talking about stuff like feeling sick to your stomach, throwing up, or dealing with a nasty case of gas and bloating. It can even lead to diarrhea or constipation, a runny nose, rashes, and headaches. In really bad cases, some people might break out in hives or have trouble breathing, and that's when you need to get medical help right away. What many people don't realize is that blueberry allergies can develop suddenly, even in adults who have enjoyed blueberries for years without problems. This phenomenon, known as adult-onset food allergy, occurs when the immune system starts recognizing certain proteins in blueberries as harmful invaders. The lipid transfer proteins, LTPs, in blueberries are particularly known for causing cross-reactivity with other fruits and vegetables. If you're allergic to apples, peaches, or cherries, you might be more likely to react to blueberries as well due to this cross-reactivity pattern. This is part of what immunologists call the fruit basket syndrome, or oral allergy syndrome. For those with birch pollen allergies, consuming blueberries might trigger what's known as pollen food allergy syndrome. This happens because proteins in blueberries resemble those found in certain pollen, causing the immune system to confuse the two and mount an allergic response. The severity of allergic reactions to blueberries can be unpredictable and may worsen with repeated exposure. What starts as a mild itching in the mouth could potentially progress to more serious systemic reactions over time, which is why documenting any adverse reactions is important. The tricky part is that salicylates aren't just in blueberries or aspirin, they're hiding in all sorts of foods. But here's the good news. If you're only a little sensitive to salicylates, you might still be able to enjoy blueberries in smaller amounts without feeling awful. Consider keeping an allergy journal to track symptoms and their correlation with blueberry consumption, which can help identify patterns and thresholds. Number 5. Oxalate concerns. Blueberries contain compounds called oxalates, which can be a problem for people prone to kidney stones. According to data from Harvard Medical School, blueberries have moderate oxalate levels, about 10 to 15 milligrams per cup. If you've had calcium oxalate kidney stones, you might need to limit high oxalate foods. While oxalates in blueberries aren't as high as spinach or almonds, they can still contribute to your daily oxalate load. What's often overlooked is that the oxalate content in blueberries can vary significantly based on growing conditions, ripeness, and variety. Wild blueberries typically contain different oxalate levels compared to cultivated high-bush varieties. Studies have shown that organically grown blueberries may have slightly lower oxalate concentrations due to differences in soil composition and growing practices. The body's ability to process oxalates also varies greatly between individuals. Some people have genetic variations that affect how efficiently their bodies handle oxalates. Conditions like hyperoxaluria, inflammatory bowel disease, and certain bariatric surgeries can dramatically increase the risk of oxalate-related problems, making even moderate oxalate foods like blueberries potentially problematic. Cooking blueberries can reduce their oxalate content by approximately 10 to 15%, according to research published in the Journal of Agricultural and Food Chemistry. This reduction occurs because some oxalates leach into the cooking water or break down during the heating process. A 2022 study in the Journal of Urology found that drinking plenty of water when eating oxalate-containing foods helps prevent kidney stone formation. Specifically, consuming at least 8 ounces of water within 30 minutes of eating oxalate-rich foods can help dilute the concentration of oxalates in the urinary tract. Pairing blueberries with calcium-rich foods like yogurt can help bind oxalates in the digestive tract, preventing their absorption. This food combination strategy has been shown to reduce urinary oxalate levels by up to 20% in susceptible individuals. So, if you love blueberries but have kidney stone concerns, drink extra water with your berries, consider cooking them, and pair them with calcium-rich foods to minimize oxalate absorption. Number 6. Dental staining. The deep blue color in blueberries comes from compounds called anthocyanins. These are great for health, but can temporarily stain teeth. Dentists from the American Dental Association note that acidic fruits like blueberries can temporarily soften tooth enamel, making staining more likely. What many people don't realize is that the staining potential of blueberries is dramatically increased when the berries are crushed or juiced. This is because crushing releases more of the anthocyanin pigments, allowing them to make more extensive contact with tooth surfaces. Blueberry juice has approximately 3 to 4 times more staining potential than whole berries. The acidic nature of blueberries, pH typically between 3.1 and 3.4, further compounds the staining issue. This acidity temporarily demineralizes the outer layer of tooth enamel, making it more porous and susceptible to pigment absorption. The combination of acid and anthocyanins creates a perfect storm for dental staining. People with microscopic cracks in their enamel or those with dental work like composite fillings may experience more pronounced staining from blueberries. The pigments can lodge in these tiny imperfections, creating uneven coloration that's more difficult to remove. The temperature of blueberries also affects their staining potential. Warm or cooked blueberries may cause more significant staining than cold ones, as heat can open the pores in dental enamel, allowing deeper pigment penetration. I am giving you some tips to enjoy blueberries without blue teeth. First, rinse your mouth with water after eating. For maximum effectiveness, swish vigorously for at least 30 seconds to help dislodge pigments before they set in. Second, eat cheese with your berries, because it helps neutralize acids. The calcium and phosphates in cheese can help remineralize enamel and create a protective film on teeth, reducing stain absorption. Hard cheeses like cheddar are particularly effective for this purpose. Third, consider using a straw when drinking blueberry smoothies or juices. This minimizes contact between the liquid and your front teeth, significantly reducing staining potential. Reusable silicone or stainless steel straws are eco-friendly options. Last but most important, wait 30 minutes before brushing, because brushing too soon can damage softened enamel. During this waiting period, your saliva naturally neutralizes acids and begins remineralizing enamel, making it safer to brush. Using a whitening toothpaste occasionally, not daily, can help remove any accumulated blueberry stains without damaging enamel. Professional dental cleanings every 6 months can effectively remove any persistent staining from regular blueberry consumption, keeping your smile bright without sacrificing these nutritious berries. Number 7. Histamine responses. While rarely discussed, blueberries can trigger histamine responses in certain individuals, particularly those with histamine intolerance or mast cell activation disorders. Histamine is a chemical involved in your immune response, and some people have difficulty breaking it down properly. Blueberries themselves contain moderate levels of histamine compared to other fruits, but they also have the potential to be histamine liberators, meaning they can trigger the release of histamine already stored in the body. This is particularly true for overripe blueberries, which naturally develop higher histamine levels as they age. The symptoms of a histamine response to blueberries can be easily confused with other reactions. These may include flushing, headaches, nasal congestion, itchy skin, digestive discomfort, and in some cases, heart palpitations or anxiety. Unlike allergic reactions, which typically occur quickly, histamine responses can be delayed, making them harder to connect to blueberry consumption. Recent research from the European Journal of Clinical Nutrition indicates that approximately 1% of the population has some degree of histamine intolerance, though many cases go undiagnosed. For these individuals, consuming blueberries alongside other histamine-containing foods, like aged cheese, fermented foods, or wine, can create a bucket effect, where the cumulative histamine load exceeds the body's processing capacity. The anthocyanins in blueberries, while beneficial for most people, can inhibit the enzyme diamine oxidase, DAO, in sensitive individuals. DAO is responsible for breaking down histamine in the digestive tract, so this inhibition can exacerbate histamine-related symptoms. If you suspect histamine sensitivity might be affecting your enjoyment of blueberries, there are several approaches worth trying. First, only consume fresh, just ripened blueberries rather than overripe ones, as histamine levels increase significantly as fruits age. Freezing blueberries immediately after purchase can also help slow histamine formation, preserving their edibility for sensitive individuals. Some people find that taking a DAO enzyme supplement before consuming blueberries helps their body better process the histamine load. When reintroducing blueberries to your diet, start with very small portions, just 1 to 2 tablespoons, and gradually increase based on your personal tolerance level. Throughout this process, keeping a detailed food and symptom journal can be invaluable for identifying patterns and potential triggers that might be compounding your reaction. For the most personalized approach, consider working with a healthcare provider who specializes in histamine intolerance, as they can offer tailored guidance based on your specific situation and medical history. Understanding this lesser-known aspect of blueberry consumption can help explain why some people experience seemingly random symptoms after enjoying these otherwise healthy berries. The right way to enjoy blueberries. Alright, let's talk about blueberries. These little powerhouses pack a punch when it comes to health benefits, but they can also be a bit tricky for some people. Don't let that scare you off though. With a few smart moves, you can enjoy all the good stuff blueberries have to offer without any trouble. First things first, if you're new to the blueberry game, start small. Ease into it by having just a handful at a time. This way, you can see how your body reacts without going overboard. For most adults, a good starting point is about 1/4 cup, gradually working up to the commonly recommended serving size of 1/2 to 1 cup daily. Next up, go organic if you can. Blueberries are often on the list of fruits with the most pesticide residue, so splurging on organic ones can help you dodge those unwanted chemicals. According to the Environmental Working Group's annual Dirty Dozen list, conventionally grown blueberries frequently contain residues of up to 13 different pesticides. Washing thoroughly with a fruit and vegetable wash can remove up to 85% of surface residues if organic isn't available. Now, let's talk about storage. If you've got more blueberries than you can eat, don't let them go to waste. Toss them in the freezer. Frozen blueberries are perfect for smoothies, baking, or even just snacking on when you're craving something cold and sweet. For optimal nutrition preservation, freeze blueberries in a single layer on a baking sheet before transferring to storage containers. This prevents them from clumping and allows for faster freezing, which better preserves their nutritional content. If raw blueberries give you a hard time in the tummy department, try cooking them. Cooking can break down some of the fibers that might be causing issues, making them easier to digest. Think blueberry pancakes, muffins, or even a warm compote to top your yogurt. Heating blueberries to at least 160 degrees Fahrenheit, 71 degrees Celsius, for a minimum of 15 minutes significantly reduces both FODMAP content and oxalate levels, making them gentler on sensitive digestive systems. Lastly, pair your blueberries with some protein or healthy fats. This combo helps slow down the sugar absorption, keeping your energy levels steady and preventing those pesky sugar crashes. Think a handful of blueberries with some almonds or a bowl of Greek yogurt topped with berries and a drizzle of honey. The ideal ratio is approximately 1:1, for every 1/2 cup of blueberries, including about 1/2 cup of plain Greek yogurt or 1 to 2 tablespoons of nuts. For those concerned about dental staining, enjoying blueberries as part of breakfast rather than as a late-night snack gives your saliva more time throughout the day to naturally remineralize enamel and reduce staining potential. Rinsing with water after eating is particularly effective if done within the first 5 minutes after consumption. If you're taking medications that might interact with blueberries, consistency is key. Rather than eliminating blueberries, maintain a consistent intake pattern and schedule them at least 2 hours apart from medication times to minimize potential interactions. So, there you have it, a few simple tips to help you enjoy blueberries to the fullest. Conclusion: as you know, blueberries deserve their superfood status for most people. But now you know the full picture, both the benefits and the potential downsides. Every food affects each person differently, and listening to your body is the best guide. If you notice any problems after eating blueberries, try reducing your portion size or how often you eat them. And remember, even natural foods can cause side effects for some people. That's not a reason to fear them, but to use them wisely. If you found this helpful, hit the like button, share it with friends and family who might benefit from knowing the complete story about blueberries, and subscribe for more honest looks at natural foods and remedies. Drop a comment below sharing your experience with blueberries.